Today we have a remarkable dentist that's part of our LHDM family, Dr. Anna Zazeta, joining me here to talk to us about her journey in orthodontics and especially Invisalign treatment. Please welcome her on the show.
Hello, Dr. Leila. Thank you for inviting me. I'm really excited to be part of this conversation today.
Amazing. But before we dive into our discussion, Dr. Anna, I want the listeners to know a little bit more about your background. So you graduated with honors in dentistry from Ancona in 1996, and your journey led you to achieve a master's in orthodontics in Rome. What's truly remarkable is your passion for interceptive treatment and your expertise as an Invisalign provider since 2014.
Yeah, thank you. Thank you very much for this kind introduction, Leila.
It's well-deserved. Now, to get to know you a bit more beyond your impressive dental career, could you share more about your hobbies and interests outside of the clinic?
Okay, yes, when I'm not working, I love to spend my free time with my family, of course, and with my friends. And I have to say that I love reading too. I can say that I'm a book lover, actually. And I love traveling because I'm like a curious person, so I love to know everything about other cultures.
Fantastic. Likewise, I love to travel and explore new things.
Yeah.
That's wonderful. And your specialty in orthodontics and Invisalign treatment, can you elaborate further on what is interceptive treatment and its role in orthodontics?
Okay, yes, absolutely. Interceptive treatment is also called early orthodontic treatment. So it's a treatment that is provided mostly to young patients during their mixed dentition. So we can address a problem, an orthodontic issue, when it emerges in the mouth, and we don't wait until all the permanent teeth are out in the mouth.
Brilliant, and I think this is really helpful for those parents that have young children. The age is usually around what for interceptive?
During the mixed dentition, so between the age of 6, 7, and 11 years old. Of course, I always ask the parents to bring their children to my office, even at the age of 2 or 3. So if there are any problems, we can even do something, even if they are very, very young.
Wow, so early. It's always good. It's again the preventative approach to everything. So what are the main reasons to undergo an interceptive treatment?
There are really many reasons, but maybe the first one is when we have like a early loss of teeth due to trauma, due to caries, due to crowding. So we have to maintain space. And we can even address like a bad oral habits, like the thumb sucking or what is called atypical swallowing.
Mm-hmm.
We can address some problems in the growth of the jaws, cross bites, overbites. There are many, many things that we can do. It's an important part of our work.
That was just to name a few, right?
Yes.
There's really a lot.
Yeah.
Incredible. So deeper into Invisalign, many listeners may have questions about this treatment option. Could you elaborate on what makes Invisalign stand out compared to traditional braces and share some examples of cases where Invisalign has been particularly transformative for your patients?
Yes, sure. Now, Invisalign is really a groundbreaking treatment option for orthodontics treatment. And I can say that now we can use Invisalign for most of the cases instead of using braces. And the Invisalign treatment is made of aligners that are almost invisible, clear. That's the main reason why most of the people are asking me to do Invisalign. But actually, there are many advantages, like the comfort of these aligners, because they are custom made, so they are very comfortable. You don't have the braces or the wires that poke in the cheeks or the lips, so it's very comfortable. And another thing that is very, very important is the fact that you can remove it. So whenever you want to eat some food, you don't have any issue. You can eat whatever food you like, and you can remove it, and you can brush your teeth properly. So even for the cleaning, it's very important. So it was used at the beginning only for adults and young adults, mostly for the aesthetic reason. But now we are using even for children, even when they are very, very young children. And last thing I want to say that the only disadvantage of the Invisalign is the fact that you must be very compliant. So you have to wear the aligners at least 18 hours a day. So, and another thing is that Invisalign is not meant for every kind of malocclusion. Sometimes you have to go for braces.
Very good point. And I don't know if you mentioned fewer emergency visits.
Yes, fewer emergency visits, of course. Yeah, because
that's very beneficial,
yes.
I think. Especially because in this part of the world, everyone travels so much.
Exactly.
That they don't worry that it's going to ruin their holiday wherever in the world they are.
Yes.
Wire poking and this and that. And just a little side note, that when patients do choose Invisalign, I think you would agree with me, Dr. Anna, that it's very important when they remove it to eat that they brush and if they can floss or at least rinse their mouth with water before placing it back on.
Yes, exactly.
Because the fit is so well that if the food is sitting there, it can cause cavities down the road. So we have to be really meticulous with our oral hygiene.
Exactly.
But anyways, so that's that. And before we conclude this extensive episode, could you share another memorable patient experience story related to either orthodontics, Invisalign?
Actually, I want to share a story about a little patient. So it's a story about interceptive treatment and Invisalign treatment together, because I saw this little patient. He was like 7 or 8 years old at the time. And he had a quite important problem, malocclusal problem, but he also had ADHD problem. So it wasn't easy for him to clean the teeth properly. So his parents were very concerned to use braces on him because it was difficult for him to clean, to brush the teeth properly. So we decided to go for Invisalign, even if I was skeptical because of the compliance. But actually, this guy was really amazing. The results were perfect. And also the best part was that he was so proud of himself. So now every time he comes to me, to my office for a checkup, he always hugs me. And because he's so happy that he managed to did it. So this is what makes my work worth of. So I'm very passionate about orthodontics, and I love when these things happen.
It's the most beautiful part of our journey with patients, and of what we do is and I think this satisfaction, in all honesty, between the two of us, I don't think many people have it in most of their jobs.
Yeah.
This is really gratifying. And on a side note, if I might say, I know back in Italy, because you do Invisalign and orthodontics, and you deal with a lot of teens, now adults as well, of course, this is very common, and preteens, you do see a lot of children for restorative work as well, right, Dr. Anna?
Yes, of course.
Yeah.
For restorative.
And you're and from what I have seen here in the clinic, you're very approachable, and the kids just love you.
I can say I'm very patient with the kids. Yes.
And it takes a lot of patience.
Yeah.
So really only the patient ones can win their hearts. Thank you so much for being on our show and sharing your inspiring stories with us. It was an absolute pleasure. And there you have it, folks. Another episode of Ask Dr. Leila podcast. Stay tuned for more inspiring stories from the rest of our specialists here at LHDM.